my screen, right? And now I just have to go into full screen, enter full screen mode.
Yeah, it looks good.
Super, thank you. Okay, and you guys don't have a banner of, I can see, I have a banner of people, but you guys are good, right? Like you just see my slides.
Yeah, we only see your slide.
Okay, super. So yeah, this is going to be a 10-step guide to modeling COVID-19 for science majors. I think when I made up this title, I didn't think about how long it would take to talk about 10 different steps. So some of them I have to talk about pretty quickly. So this is a talk about COVID, and before I get into it too much, I just wanted to acknowledge the situation for COVID in Newfoundland as it stands today. So I took this graph off the Public Health Agency of Canada's website yesterday, and you know, I kind of feel like today is a happy day. In 11 hours on the Avalon Peninsula, we're moving down to level 4. You know, early February, it was, you know, there was a lot of uncertainty with the B117 outbreak. And, you know, I'm really proud of what we've been able to do in Newfoundland and Labrador, particularly on the Avalon Peninsula. You know, everyone's made sacrifices, and it's, you know, we don't get to celebrate much during COVID, but maybe there is one brief moment today where we can be proud of what we've done over the last few weeks, because I mean, it's such a relief for everyone, right? Just to not have that burden of a heavy caseload hanging over us. So I think giving this talk today, I have a little bit of an undertone of feeling really happy about what we've been able to achieve in the province with our COVID control. Okay, super. And I saw this on Twitter. The St. John's Morning Show is asking what has been one silver lining during the pandemic for you over the past year. And I think for me, the silver lining has been the way that models have really captured the public's attention, the way that models, you know, people are asking for, the public wants short-term predictions. And, you know, this has really been, I think, part of the way that we've been expected to do science around around the epidemiology, and just to see the way that models have contributed has been really inspiring. And I think this is just going to gain momentum, and in the future we're going to see more adoption of modeling and coding and data science, and this is for me going to be one of the really great things that's come out of the pandemic. So this is my list of the 10 steps that I think really can help inform how to do good modeling for COVID. And this is kind of aimed maybe for anyone. You know, you could be a high school student and I think appreciate a lot of these principles, or undergrad, grad student, or, you know, even established researchers who are just looking to do a bit more coding and modeling in their work. You know, I think you can jump in on board with these kind of principles at any time really in your career. So step number 1, learn R or Python. I think if you're on a more biology or epidemiology bend, maybe go for R. If you feel like you're more computer scientist, data scientist, go for Python. But there's really, you know, you can't really make a wrong choice here. Choose one and learn them. And there's a lot of free, they're both free softwares. There's a lot of resources online to get you started, tutorials that you can work through that are free. So if you want to get started, just, you know, work through these tutorials. Software carpentry is excellent. This is data science for ecologists and environmental scientists. And we've also recently started at Mount a quantitative training initiative for our biology majors. We also have a training manual where you can work through some exercises in R to get you started. And it's a little bit of effort to learn a scripting language, but once you start doing it, you just start to see like rewards, you know, really substantial rewards. And so just to give an example of that, these are some things that I was able to do with some R packages. The thing about R packages is someone else has mostly done the work, and then you just have to do a little bit of work at the end, fixing up what you want to do for your specific situation. And so on the top here, I was working with this package called Outbreaker 2, and it's used to try and recreate clusters during outbreaks. So I was trying to understand a bit more about the number of secondary infections and just who was infecting who within the most recent B117 outbreak in Newfoundland. And I mean, I wouldn't take a whole lot of meaning from that infection tree that I have there, because I was just using public data for this. But with the good data from public health, together with this package, I think you could start to understand a lot more about who's infecting who within our recent B117 outbreak. You can look at the distribution of secondary infections here. So in this graph, you're mostly seeing people not generate any secondary infections. That's a bit of an artifact, because people who are recently infected haven't really had the chance to infect anyone yet. But you see, a few individuals causing, 16 infections. But the point of this is that I didn't actually do a ton here. Most of the work was done by the people who made this R package, and I just had to figure out how to use it. And this is all free, right? And then on the bottom, I was doing some modeling around the impact of having increasing variant of concerns in mainland Canada and the rest of the world, really, and travelers coming to Newfoundland and having a higher proportion of them be infected with a variant of concern. And I wanted to do some stochastic modeling. And again, I didn't really write the code for that myself. I just used a package. So you learn to use R, and then all of a sudden, other people use R, and they made these softwares for you, these packages, and you can just borrow them, and you don't have to. It didn't take me very long to make any of these graphs, because other people mostly did the work. When you're starting out coding, I think, you can feel really shy about what you've done and not want to show anyone. And it's, I think, really good practice to publish your code first off and share your code, and just a couple of references to encourage you to want to do that. The first article kind of talks about, the code that's in your TV or your phone is probably badly documented, inconsistent, and poorly tested. So, don't worry so much obviously you don't want to do a deliberately a bad job, but when you're learning, I think there's so much value from making your code publicly available, and that value really outstrips that you leave yourself open to a bit of criticism, because maybe people don't find your work cutting edge or the best methodology. And just to make you feel even better about that, this is a news article about the Imperial College's agent-based model for COVID, probably the most famous model for COVID in the world. It's said that it's judged as reproducible, so it passes the code check, but software engineers called it horrible and a buggy mess. So, this has been a hugely influential model. It's been really important. And, just if people are giving you a hard time about your code and you've really genuinely tried to do a good job, just, you're kind of not alone. There's, scientists out there who should be really proud of their COVID efforts, but have, been catching a bit of criticism for their software, and, they made it open, so good for them. Step number 2 is to start using publicly available data. There's really quite a lot of data out there that you can start practicing your analysis on before worrying about trying to get official data sources that might be time consuming to try to acquire. And so this is just 8 lines of code or less, really, and it is this is line listed data for COVID for Canada. I'll give a bit more details about the data source in a second, but so I just think this is amazing. I write the one line of code at the top there, read CSV, and it pulls data from a website that is updated daily. So as soon as I run that command, I get a daily refresh of the data from when those people updated their database. And then I just say, well, forget the other provinces. I only care about Newfoundland, and extract that. And then in the bottom there, I'm interested in how many cases from 2020 were travel related, and how many were close contacts or community spread. And I just think it's amazing that I write those few lines of code and I can get that information back. So what it's telling me is that in 2020 for Newfoundland, whether it was travel related was not reported in 251 cases. That's probably a lot of the calls cluster when public health was very busy. Travel related, 95 travel related cases and 44 not travel related cases. And then down the bottom, you kind of see one of these issues of why we do a lot of data cleaning. So there were 2 reported cases that were community spread. And then is that 42 instances of close contact. But you'll see that you have to clean up this data set because there's a capitalization inconsistency on how that data was put in there. So that data set is freely available, hosted on GitHub, maintained by the COVID-19 Canada Open Data Working Group. And that is really led by 2 PhD students from the Della School of Public Health and the University of Toronto. And that group goes through media reports from public health throughout Canada, and whatever they're telling the media or reporting on their websites, they take that information and they put it into this database, and they do that every day. And so it's not an official data source, but I mean, I work with the Public Agency of Health, Public Health Agency of Canada as well. And, you know, they will talk about, well, why don't you just go and, I mean, they consider this to be a reliable data source. The only reason why it's not reliable is that there's inconsistencies in the information that public health will make public between provinces and even day to day, just depending on what their workload is or what messages they're trying to send. So it's a good start. You can make a lot of progress here. So knowing the different types of models is the third principle that I think can help you do a really great job of modeling COVID. And so we're going to start with agent-based models. Agent-based models are probably the easiest to understand. You kind of take what you know about the problem and literally just turn it into computer code. And agent-based models are when you're simulating agents and they act according to specific rules. So for COVID, this would be like you code individuals, and if you want to do St. John's, you make like 120,000 literal individuals, and then you make them do things like go to the office and then come home, and then maybe they get sick. But it's sort of like creating a virtual version of reality in some respects. So these are considered to be quite data hungry. You need to collect information on households, how individuals travel to work, and what they do on the weekends. They have really high computational demands. So this again is the COVID sim by Imperial College, and that you can download that model, but you need 20 gigabytes of RAM to actually run it. And I didn't try it on my MacBook Air because it was only 4 gigabytes, so that wasn't going to work for me. It's really the advent of modern computing that has led to quite a big takeoff in agent-based modeling, because as you can imagine, this type of computing has only really recently been available. So another type of mathematical model, I'm going to call it stochastic model. Its origins are in mathematics, and so it goes back you know, historically quite a bit further than agent-based models, which are more of a recent thing. And for epidemic models that are stochastic, they probably go under different names, making everything kind of confusing, probably for non-experts. So sometimes branching process models, probability model, birth-death process, Markov model. A lot of epidemic models probably could also be called these alternative names for the stochastic models. So people will call them different things, and it makes it a bit confusing. The other thing that is a bit confusing is that it's not really clear where the line is between an agent-based model and a stochastic model. In a lot of respects, you can still think about your stochastic model as comprising of agents that go around and do things. In the example of the stochastic model that I have down the bottom, the agents get infected and they recover. it's the simplest kind of example how I was trying to communicate what a stochastic model is. Certainly you could make it more complex than this, but just to try and describe how stochastic models might be formulated. So here S is going to be the number of people that are susceptible to infection. So maybe like 120,000 people in St. John's, and I is going to be the number of people that are infected at time T. So let's maybe say that that starts off with 1. And now we want to say, well, in some really small increment of time in the future, maybe say tomorrow, how many people are susceptible and how many people are infected. And it's just a statement about what happens when someone gets infected. So when someone gets infected with probability, there's a transmission coefficient. It depends on the number of susceptibles and the number of infected people. Then an infection occurs. And when an infection occurs, then I have 1 fewer person susceptible and I have 1 more person infected. And the other event that can occur in this very simple model, SIR, but a stochastic version, is recovery. And when recovery happens, and that has a probability, gamma times the number of infected people, then the number of infected people just goes down by 1. So written like this, it's kind of a Bernoulli random variable, but you can make this more complicated and include different states of the infection, like pre-symptomatic or asymptomatic. And you could, have people live in houses if you wanted. You can change the probability distribution to a Poisson distribution or anything that seems appropriate. That's just kind of to give you a flavor of what they might look like. So we used a stochastic model when we were looking at the effect that the travel restrictions had on the number of cases that occurred in Newfoundland after May 4th when travel restrictions were implemented. And this is just the output of our stochastic model where, because it's stochastic, there's random variables and you can see a range of outcomes. So this is after 6 weeks, the total number of infections, and you've got a range of values. And also there's pretty heavy dependence on the social distancing compliance that is in place among the local community at that point in time. And so this contact rate is relative to pre-pandemic levels. So 70% of pre-pandemic levels is the highest level that we considered. And we're just in yellow and green, we're comparing the difference with travel restrictions versus without travel restrictions. So without travel restrictions, people come to the province, they're infected, and then in the local community, the infection spread. So that was a stochastic branching process model that we did. And then the other model that I want to talk about are compartmental models. And again, there are multiple names for these, so it can be a bit confusing to know that different things are actually the same thing. So ordinary differential equations, susceptible, infectable, recovered, SIR models, and then we kind of run with lots of different letters, SEIR or SLIAR. So these are including individuals that are exposed and latently infected. So those people who are infected but not yet infectious, and those people who are infectious but not yet symptomatic. We like to put those letters everywhere. Deterministic models is another name for compartmental models. And usually mathematicians like to communicate the assumptions of these models to other mathematicians by writing out a system of differential equations like this. This is a really compact way to communicate assumptions to other mathematicians, but maybe not a super helpful way to communicate much to anyone else. So a lot of times we also draw our compartmental models in a picture like this. So the equations that I showed here are depicted as the COVID-19 model down the bottom here. And this just illustrates what types of transitions are possible and what aren't. So when you're a susceptible individual, you can next become latently infected. And you notice that you can't just jump to asymptomatic. Asymptomatic here is an infectious state. You can transmit infection here. You can't jump from being susceptible to being clinical infection. You have to go through preclinical first. And so these types of diagrams are almost dogma for compartmental models that you should provide them to help people translate that system of equations into something that you can kind of make sense of. But you really could draw that type of picture for your, I could have done it for my stochastic model and the agent-based model as well. You could also do that. Okay, so next let's talk about another type of model, which is statistical model. This is from Public Health Agency of Canada's slides for modeling presentations that have been given. And here we're trying to do a short-term forecast on the number of cases in the future. And a lot of times these are done with generalized linear models or other types of more statistical models. And I'm going to contrast those with mechanistic models, where for mechanistic models, the parameters have a meaning, and so they can be independently estimated. So for the statistical model, the parameters that you have are slopes and intercepts. And it's not always easy to understand what those are practically. Whereas when you have a mechanistic model, it has parameters here like the transmission coefficient, and n is the total population size. So I've been saying St. John's has a population of 120,000 people repeatedly. So that parameter n is something that I can estimate independently. And I think that's what defines the difference between a mechanistic and a statistical model. And this is an example of a short-term forecast that I had done kind of early in the B117 outbreak here in Newfoundland. It overestimates dramatically how many cases we actually are going to see in B117 outbreak, because I guess the data was heading in that direction at the time. But this is a mechanistic model fit here to data. And one of the things that I was able to do, because this was a mechanistic model, is that I could look at how many cumulative cases we would have seen if this wasn't B117, but it was just the regular wild type strain of COVID. The reason I can do that is because there's reports out of the UK talking about the net reproduction, the effective reproduction number is 40 to 70% larger for B117. So I've done this model fit here for B117, and I can calculate the reproduction number from that because this model has mechanistic parameters. And then I can say, well, what if the reproduction number was 50% lower? How would things be different? So I can do this because it's a mechanistic model, but if I had done it here where my parameters are slopes and coefficients, and it's hard to translate them into some kind of meaning that relates to the reproduction number, then I can't really look at how things might have alternatively played out if it was wild type strain versus B117. Step 4 is to know when to use the different models. So if you want fast results, which sometimes during the pandemic that has been very important, agent-based models are not going to help you because they often run pretty slow. I mean, it's not universally true. Of course, you can come up with counterexamples where you make it something that satisfies the definition of an agent-based model, but is quite simple, so it runs quite fast. But generally, there's a gradient of complexity running here, where the agent-based models are the most complicated, the stochastic models are somewhere in the middle, and the compartmental models are the simplest. And so that also kind of is, there's generally this gradient, although it doesn't necessarily have to follow from the definitions. So compartment models are really fast. Like if I run them on my laptop, then it just finishes instantly. In terms of whether the models make realistic assumptions, then the agent-based models do. Like you can do whatever you want. The stochastic models kind of really span the middle. You know, you can make stochastic models that make very realistic assumptions, or you can make them that make very unrealistic assumptions. And for the compartmental models, they, might have to be framed as an ordinary differential equation or delay differential equation. And so you're a little bit constrained by the implied assumptions that come with that formulation. So this is the trade-off between speed and realistic assumptions, that the compartmental models are fast, but have the least flexibility in terms of making realistic assumptions. The compartmental models are also not really appropriate when you have few cases. You would need to build at least a stochastic model to handle that. And then, maybe this is a little bit uncontroversial, but or sorry, a little bit controversial. I think the compartmental models give you the most insight. They run so quickly, you can explore alternative parameter values, and you can spend a lot of time trying to understand why you're getting certain results, or just learn about the principles of epidemic dynamics. Whereas agent-based models, I think you generally get less insight because they take quite a while to run, and I think you have less ability to really probe the models to understand why predictions are coming out the way they are. And then for statistical mechanistic models, statistical models are good for short-term predictions where the goal is to take data and understand what the likely future trajectories are. But you can't really do scenarios like what would be the effect of the travel ban with statistical models. Whereas for mechanistic models, you can maybe do both short-term predictions and scenarios. And then there's also ensemble models where you take a whole bunch of different models and put them together. This is used for climate modeling, right? And then the predictions are an aggregate of all these different models that you put together. So this is an example of an agent-based model. It is the imperial model. And this has been a very useful and informative model and influential model for informing COVID-19. It's an agent-based model. This is another, I think, really well done agent-based model, which is for Massachusetts, and is parameterized using cell phone data, considers spatially resolved age structure in terms of number of kids and adults, divides people up into households. These people go to work, and there's a school layer as well. So it's just another really helpful model for understanding healthcare demand. And this is the Public Health Agency of Canada's agent-based model. And yeah, these models, I think you have quite a bit of confidence in the assumptions going into them. And yeah, there was a lot of work for these groups to put them together. So these have been really influential. So now I'm going to talk about the downsides of the agent-based models. This is maybe my favorite paper that maybe anyone has ever written. It's called 5 Ways to Ensure That Models Serve Society, a Manifesto. And it makes some really great points, particularly this section. So makes a point that many are seduced by the idea of adding complexity into models in an attempt to capture reality more accurately. There's a cost to that, and that's that the more parameters and compartments and heterogeneities that you put into the model, the less accurate the predictions become. And the more parameters that you put, the uncertainty builds up and the error cascades to the point that it can make the predictions be essentially useless because there's so much uncertainty in each of the parameters and just so many parameters there. So this paper gives a really balanced discussion of the issues. So the Imperial group had an agent-based model, but I mean, they certainly have a very strong background in the other modeling approaches as well. And I think probably one of the reasons why they can be so successful with their agent-based model is they have such a robust understanding of the simpler mathematical models, and that really catapults their ability to do an effective job with their agent-based model. But that group also released global predictions that were based on a simpler SEIR model. So this is your compartment model that's ordinary differential equations. And the SEIR model, the really simple one that would run instantly on my laptop, predicted that the US would have 1.8 million deaths if no action was taken against the virus. Whereas the one that is so large, I can't even run it on my laptop, and I don't even know how long it would take to run, predicted 2.2 million deaths. So these actually give broadly the same conclusions, despite the fact that one was a huge amount of effort and one you can sort of throw together in a few minutes. And I mean, you can even sort of see this from this graph. So, the bottom plot, this is very wiggly line, kind of reveals to me that this is quite a complicated model. But this is a zoomed in picture of the top graph. So this is, looking at whether healthcare capacity is exceeded, and you can kind of see these curves. They just really look like the kind of curves that you get out of a compartmental model. So it's not really surprising that the compartmental model is doing a reasonably good job when you've got just so many infections and when you're only interested in the mean. Yeah, and just to keep hammering on models with lots of parameters, Peter Coveney, who is a chemist and computer scientist at the University College London, kind of an outsider from the field of epidemic modeling, saying that there was concern that the models that were being used by the epidemiologist had an observed number of parameters in them and they can't possibly be right. And he looked at the, I guess, 940 parameters in the imperial model. It can be whittled down to 19 that really only affect the output, and even just 3 variables account for 2/3 of the differences in the model's results. So you have a really complex model, and you feel comfortable about the assumptions that that model is making, but you can really probably reach the same conclusions with a much simpler version of the same model. And I'm going to give Neil Ferguson a chance to respond now after just hammering him. Nature asked him if he'd learned any lessons, and he just mentioned how fast the work had to be done, which is absolutely fair in an emergency situation. And also emphasize that none of the criticisms of the code affects the mathematics or the science of the simulation, which again, I think is absolutely fair. I think, yes, the agent-based model is very complicated, but you're talking about a group of scientists that know their simpler mathematical models very, very well, and they have confidence that the agent-based model is giving something sensible because they have so much experience with the simpler models. So step 5 to being a great COVID modeler is to fit, calibrate, and validate your models with data. Quote from Brian Grenfield, who is from the University of Cambridge: "Data are necessary if the models are to be at all applicable. It is all about the data." Going back to the Public Health Agency of Canada's agent-based model, this is their paper. I don't remember when it came out, but they're showing the results for the agent-based model here. It's not actually fitted to data at this point. Subsequently, I have seen the same model fitted to data, but this has been more of a recent thing. I think it probably took them a substantial amount of time to be able to fit their model to data. I think we're talking on the scale of months, maybe 6 months or more. And when you think about it, it's not going to be easy if you have a model that takes 15 minutes to run, and now you want to fit one parameter. Well, you're going to have to run the model for different values of that parameter until you find one that fits the data. So you're taking a model that takes 15 minutes to run and maybe having to repeat that 1,000 times until you find the best fit value of one parameter. And that's not really, conceding that you probably want to fit more than one parameter. And so it becomes quite, these models take a long time to solve just by themselves. And then when you add in this demand of trying to fit them to data, it is really computationally intensive. Of course, it can be done. This is a model from France where an agent-based model has been fit to data. Nate Osgood from the University of Saskatchewan has a model that is agent-based model and fit to data. And now the Public Health Agencies of Canada, they also have fit that model to data. For your stochastic models, you can use a package called partially observed Markov chain from R. And there's a really nice description of how to go about fitting stochastic models in the paper that I cite below by Sebastian Funk and Aaron King. And in Canada, some of the open source software that we have for fitting epidemic data is McMaster Pandemic. And that too, I believe, uses this partially observed Markov process fitting routine. The easiest to fit would be your compartmental models because they run instantly and you can search over parameter space quite efficiently. So on the left is the model. The first author on this paper is Sean Anderson, but this is work out of the BC group of modelers, Caroline Collane out of Simon Fraser University and Dan Coombs from UBC. So it's a compartmental model, and they're using a Bayesian approach for fitting the model, and that's another package actually that's freely available on R. And on the right is the one that I had done for compartmental model fit. So these are the least computationally intensive for model fitting, but I still find it doesn't go well most of the time. When I do something like a linear regression, that works every single time and it happens instantly. And then you have a line that's fitted through the data points and it looks great. But when I try and fit these mechanistic models, I mean, you have to give guesses for what your initial parameter estimates are. And a lot of times it comes back saying it wasn't able to find the parameter values, or it finds them, but then I plot it against the data and it looks terrible. And so you have to really troubleshoot through where you're having your issues quite a lot. And that's the same, I think, for the stochastic models, even bigger problems there. And certainly that paper by Aaron King and Sebastian Funk talks about the steps to trying to get the whole thing to work, because it requires a bit of supervision from a scientist to make sure that the computer just doesn't do something weird on its own. You want to communicate your uncertainty and evaluate your sensitivity. So for uncertainty, you can have uncertainty due to observation error. You can have uncertainty in parameter estimates, not really know how many infected individuals there were in the beginning. And you can also have process variability, which is the stochasticity. And there's also sensitivity analyses. And so this is where you aim to try and find out what is driving your uncertainty. And you can do your sensitivity analyses formally, but I think you really want to try and just think about things too, and think about, of everything that I assumed, what is there one thing that really stands out to me as the thing that my results are probably most sensitive to? I think it's really important to do this sort of informal sensitivity where you try and think about what your model outputs are sensitive to. So another source of uncertainty is your model choice. And so modelers have a responsibility to communicate their assumptions. But I also think that, anyone can criticize a model for having made assumptions, because models make assumptions. That's what models are. And so I think sometimes modelers get a little bit too much grief over their model assumptions having been violated. I don't think the problem with models is that their assumptions are violated. I think problems are when their assumptions are violated and those assumptions are driving the results. So I think when you're evaluating the quality of a model, I don't think it's constructive to get too hung up on what assumptions are violated. But it is really important to get hung up on what are the results sensitive to, and are the assumptions around that sensitivity met or not. Another thing that's important is to identify local specificities. So this is a graph put out by group CDRAP from where they're looking at what could have been the possible pandemic COVID trajectory. So there was this idea of peaks and valleys, which would be public health putting on and taking off restrictions. There was a fall peak, and there was slow burn. And I never really felt a huge affinity for this graph graph living in Newfoundland because, you know, a lot of times this graph never shows zero COVID cases, but a lot of times we did have zero community cases. So I always felt like this was a graph that was more suitable for big places. Some local specificities that I think have affected COVID in Newfoundland are prolonged periods with no community infection. Importations actually matter when you have so much community spread. Maybe importations don't matter so much, but they matter a lot here. They're a high proportion of our cases most of the time. Rotational workers, I think this is a unique aspect of Newfoundland. Vulnerable populations, few ports of entry, small communities, I think is maybe important to consider. I think that possibly Newfoundland is really quite tight knit, and that helps with us want to buy into public health measures and do something that's constructive for the public good, because I think we feel, you know, quite connected to, you know, a lot of other people in our small community. You should have a hypothesis and reflect. This is where I think biology training has such a strong role in data science. I don't think it's super great to just take some data and throw your R at it and make a graph and, you know, what are you doing? I think you got to first formulate a question, have a hypothesis. What are you expecting to come out of this analysis? And then when you finish your analysis, go back and say, was my hypothesis satisfied? And if it wasn't, why is that? I think these are really important steps to try and figure out whether what your model is recommending is really something sensible, or whether maybe you've got an error in your code, or your assumptions are really crazy, and you know you gotta really do these checks and balances on your models. These steps are taken from the Otto and Day textbook. I think it's important to adapt and be flexible and get feedback. This one kind of still nags at me. Early in the pandemic, there was this question about what should be triggers for re-implementing public health measures. And, you know, there were these ideas that, oh, maybe when you get a certain number of active cases or a certain number of epi-linked cases, that this would be a trigger to re-implement public health measures. And I think that idea was predicated that there should exist some sort of intermediate value, you know, like 10 active cases would be a good trigger. But then having done the analysis, and it really kind of turns out that you want to go early, like as soon as you feel like you have non-epi-linked cases and you don't know where they're coming from, you really got to go with your public health measures right then. And I remember telling this to the public health agencies in Canada, and they were like, well, how do people feel about this? And I was like, well, I mean, yeah, like no one really likes this idea, and no one really wants to go under public health restrictions when you've just seen like a couple of non-epi-linked cases. I think there's still, and at that moment, like I feel like as modelers, we sort of needed to seize on that moment and come up with a better idea. Not necessarily one that was mathematically optimal, but one that played better on how public compliance was going to work and just come up with an idea that the public could really get into. And I still don't think we've really figured this out as a sort of complex communication behavioral feedback issue that just, you know, the math needs to be adapted, and there's just a lot of limitations around how we've tried to tackle this problem so far. And the last one that I want to say is this is stole this quote from Proton Raman from like a year ago, that modelers make recommendations. So, you know, your models are not like, people don't have to do what your models say. You know, the models, I started off doing my modeling, sort of having a really broad view of like, okay, what's the question? How should I go about this? And like start off with quite a broad perspective, but then pretty soon you get tracked into like, okay, well now I have to write the code and do the parameters, and I'm like very narrow and into stuff at that point. And meanwhile, you know, public health is out there like connecting with the people and you know, like talking to hospitals, and you're never as a modeler going to have the full picture, and your model's going to make assumptions, and you know, you I always feel like, I will do my best to make a recommendation, but and I'll try to see the big picture, but you can never really see things from another person's perspective. And at the end of the day, it's public health that makes a decision, has to take the responsibility for the decision. So models just make recommendations. So that's my 10 steps. Learn R or Python, get started using publicly available data, know the different types of models, know when to use the different types of models, calibrate, fit, and validate to data, communicate uncertainty, and evaluate sensitivity, identify local specificities, have a hypothesis and reflect, be flexible, and know that modelers make recommendations. So with that, I want to do some acknowledgements. I was trained in mathematical modeling through a lot of math institutes in Canada. I've been to a lot of EPI workshops from the Fields Institute, the Banff International Research Station, and also organized by the York Centre for Disease Modeling. All of these institutes are likely going to be running EPI modeling workshops in the future. So if you too want to be trained under these institutes, there should be a lot of opportunities in the future. All my research has been funded by NSERC. I just want to acknowledge some of the really important people from having contributed to my training in math epi. Jinhong Wu was a leader during the time when I had gone to a lot of these math epi workshops held throughout Canada. Pauline Vandendreich and Fred Brouwer are both retired now, but are really leaders in mathematical epidemiology, and I hope are proud of what the community has done now when we've really been called on to try and step up and do pandemic modeling. And I also want to acknowledge the predictive analytics group and NILCHI. Another really rewarding thing of doing modeling during the pandemic has been just how supportive colleagues are. Like a lot of times we're reaching out to each other and just getting advice and no one really expects anything in return, and we're just trying to do our best. And also just to acknowledge my family, because I mean, at one point there did used to be a separation between work and family, but now, when I work, my family is there like all the time, and just to especially acknowledge my husband, Sean LaRue, who's looking after the kids right now, because only one of us can really work at a time. And so, all this just really has been extra sensitive during the pandemic. So yeah, I've maybe gone a bit over time, but I can take questions now if anyone has any.
Thank you so much, Amy. That was really interesting and I think so topical, especially right now. Maybe you shouldn't have given us all 10 steps though, because I think in a couple of weeks you'll have some competition, some people trying to get on the Newfoundland COVID modeling team. And Adam has a question. Adam, you want to ask your question?
Yeah, thanks. Thanks, Amy. Great talk. I was curious, so I had a question about the idea of like whittling the parameters down in one of those huge agent-based models. Like it seems like that kind of sensitivity analysis is something that people commonly do with compartment models, as you mentioned, because they're simpler to make. But that slide where you have like the 900 some odd parameters and somebody whittled them down to like 19, that seems like an incredible insight. And like, I wonder if that type of thing, that type of approach is common in agent-based, amongst agent-based modelers, where you just like pack everything you can think of into a model, parameterize it all, and then like try and whittle it down. I don't know, like could those types of insights where you find, oh, the whole thing is sensitive to just these main 19, can that kind of thing inform like public health measures, for example?
Yeah, I mean, I feel like everyone has a role here. I don't really identify so much as an agent-based modeler, but at the same time, I think a lot of people really like them. And yeah, I think what you're saying, that you can take the agent-based model and whittle it down to just the 19 parameters, and that can be useful, sort of illustrates a kind of really productive synergy between people who do agent-based models potentially and those who maybe would have started out with the parameter that just had the model that just had 19 parameters. And Um, yeah, I mean, I think agent-based modelers, so I noticed in the library, Railsbeck and Grimm is kind of like the Bible for agent-based models and ecology. And I noticed that we actually have that in our library, and I started reading it a bit for this talk. And I mean, there is some discussion there. There's approaches like the pair approximation methods and moment closure, where you can start to make links between the agent, and definitely like these stochastic models as well, where you can start to make links between the mathematics and the agent-based models. So yeah, like I was trying to say in the talk, I think it is really, I think sometimes the agent-based models are so glamorous because everyone can relate to them so much, because they kind of take reality and turn it into computer code, and you're using high performance computing. And um, non-specialists are like, oh wow, like it's real and people are really going to work. And I feel like this is the right thing to do, because the people are really going to work, and you haven't showed me like derivatives, and stop talking to me about derivatives. But there's just so much synergy there. And I feel like I completely haven't answered your question, but since I'm working from home, the only books I have are the ones in my house. And I noticed Sean bought this book called Ecological Forecasting by Michael Ditz. It's fantastic. So yeah, it covers, actually doesn't cover agent-based models at all, but I think it's all good. And all of these approaches are contributing something valuable, and it's good to try and really think about the value that comes from all the different approaches.
Yeah, really interesting. Thanks.
I think Joseph has a question.
Yes, thanks, Amy, for the talk. Really insightful. Yes, my question is on the compartmental models. Well, it seems like we've tried to discourage the issue of more parameters, but for compartmental models, then the more parameters we have in the model, the more realistic it seems to be. Like normally that is also, people try to put in more parameters and make it more realistic. So once you think of something that is not considered, then you want to put it into the model. And that is by introducing another parameter. But per the talk and what some researchers did, the more parameters doesn't always help. So my question is, what should be the baseline to consider which parameters should really be given priority in doing some of these models, so that you're not putting too much parameters which may complicate the model, but eventually to not be useful?
Yeah. I mean, I do set up a bit of this false dichotomy where I kind of say that agent-based models are the most complex and compartmental models are the least complex, but you certainly can make really complex compartmental models also. So you can do things like model selection using AKE information criteria or likelihood ratio test. And that is an approach that considers both how well the model fits the data and how many parameters you're fitted. And so if you've fitted a lot of parameters, then your model might not do so well. So you can build compartmental models with various numbers of parameters and then do statistics on them and find out which is the most parsimonious using AKE information criteria. So this would be the model that is not too complex, but also has a good fit. So I think that would be one approach. And then I guess the question is partly around how much certainty. I think this idea of uncertainty and sensitivity is probably part of the answer to your question as well. If you're going to add in more parameters, but you're really uncertain about their value, is that really something that you want to, is that really a good idea? I guess, if you have absolutely no idea what the parameter value is supposed to be and the conclusions are really sensitive to it, maybe it's just not going to help your own understanding at all to put that in there, because it's just maybe going to confuse things. Sometimes I think of this as a bit like how you construct experiments, and that, you know, you want to control for things that are going to affect your results and just manipulate one thing that you know is a main driver. So I think, again, I would maybe say that this modeling book of Sean's for ecological forecasting does a pretty thorough job of talking about some of the really complex issues around trying to understand sources of uncertainty and sensitivity. And I think that goes back to how to build good models too.
Are there any more questions from the audience? I guess if there's not, I might ask one, if that's okay. I feel like there was a rush with there was a lot of publications last year, and like people were kind of like rushing to publish. And one of the results of that is like messy code. Have there been any models that were published that were like wrong or like really, really far off?
Oh, I'm sure. Like, I'm sure, but like, I don't really. I mean, I think one of the things that's helped me is we've also, during COVID, I kind of started reading preprints. It wasn't really, you know, you wouldn't cite preprints before the pandemic, but now it's apparently cool. You can get away with citing preprints all the time. But one of the things that helps me is I kind of know people's reputation. And if someone has consistently published good work for the last 20 years, then I'm fairly sure that they probably know what they're doing with COVID too. And so I tend to only read that stuff, but I'm sure there's lots of stuff out there that is bad. Yeah, so definitely, you know, non-specialists, you know, that, you know, I've seen stuff where people haven't cited anything or they've only cited like Kermit McKendrick. Like, it's sort of a red flag if, you know, you're not citing kind of the cutting edge stuff, that maybe this isn't really the greatest, you know, well thought out work. But yeah, it's definitely been a shift in the way publications have happened during the pandemic.
Cool. And I think Yolanda had a question, but I think she might be gone, but maybe you can answer it just in case she's still here. So what do you think the biggest barrier to communicating about models to decision makers is?
Oh my goodness. I think the point I made about assumptions is really hard. Like, I think a lot of times you get made to feel guilty if you've made an assumption in a model, but of course you have. And I think communicating that, yeah, I know that assumption is not realistic, but it doesn't really matter. And what's beautiful about my models is actually where I've made the assumptions. And you know, it's paining me that you hate my assumptions right now. So just the point, I think that it's really what your model is sensitive to, and have you made good assumptions around that point? That's most important. And you know, of course my model has made assumptions, and of course some of them are unrealistic, but just to try and move past that.
I guess you have to also explain those assumptions to the decision makers, whether they want to hear it or not. Yeah, it must be very difficult.
Yeah, I mean, you can get off the hook with this. We just make recommendations business, right? So.
Well, that looks like all the questions we have today. So thank you so much, Amy, for speaking to us about COVID. Thanks for all the work you're doing for the province. I think as a community, we really appreciate it. And I'd like to take this moment just to remind students about BGSS. You can sign up for the next 2 weeks to speak at BGSS, which is really great. Looks good on your CV, it's good practice. And there's also some WIPS grad student seminar series positions still open for the next couple of weeks. Thanks, everyone.